Hey everyone, welcome back to APRLI's Scientific Spotlight series. I'm your host, Brenda E. Today, I'm joined by Dr. Kevin Tran, the founder of the Phoenix Community, a group of more than 240 APOE4 carriers turning their risk for Alzheimer's disease into proactive health tracking. By monitoring their blood work, cognition, and lifestyle interventions, many hope to qualify for an Alzheimer's clinical trial. Continue listening to learn about Kevin's journey, an APOE4 carrier himself, and how he's empowering the Phoenix community. Without further ado, here's Kevin. Hey, Kevin, it's nice to see you again. Thank you so much for coming on to this Scientific Spotlight episode.
Thank you for having me, Brenda.
Yeah, so we haven't known each other for very long, but I would love to highlight your journey and just your story and share it with everyone in our network. So, I just want to dive right in and kind of ask you what inspired you to go into science and medicine specifically.
Sure. So when I was a kid, my mom actually got diagnosed with cancer. When I was in high school, I was actually going to be an astrophysicist. Yeah, changed path
Yeah.
into going into science because of my mom and wanted to help. So I went into pharmacy. So I became a doctor of pharmacy, graduated in France. I did quite a lot of different things when I was a kid, very rebellious. So I played chess competitively, then video games competitively, then poker competitively. You could see the decline in terms of
Yeah.
that.
It does.
But
It just changed. Yeah.
in the end, still finished, graduated, and then went into uh, pharmacy, both at the hospital and in community pharmacies. I actually hated it because it was extremely slow. Felt like I didn't have any impact. Then went to work for a pharmaceutical company in France. And in the first 2 weeks, I had McKinsey come in and saw what they were doing, loved what they were doing. So decided to switch to consulting for pharmaceutical companies. And that's when I moved from France to Singapore, where I've lived for 10 years before coming here to SF. And the major part of my career is in strategy consulting for pharma companies.
Oh wow. So you passed that test that everyone has to take at McKinsey. That's, I think that the chess and all the strategic, things that you picked up as a child really prepared you for that.
Yeah, so I didn't do McKinsey, I did BCG in the end, but yeah, similar stuff.
Ah, okay. BCG is still good. We know a few people, and yeah, I mean, really impactful work, right? For you to forecast and assess. So that's kind of what we need as a strong nonprofit organization, right? A good trajectory, right? Those are really important talking points to gather from consulting
Mm.
groups. So thank you for your work there. And that's really interesting. Wait, so you were born and raised in France and then in Singapore, and you did most of your career
In Singapore.
in
Yeah.
Singapore, and of course made a lot of connections there. Tell us what you're doing now, and
Yeah.
tell us more about the Phoenix community.
So in short, I discovered that I carry two alleles of the APOE4 gene 11 months ago. So you can discover that by doing any type of gene testing, whether it's a 23andMe or whole genome sequencing. And the APOE4 gene is basically one of the biggest life-modifying genes that you can carry. You can either have one or two, like one from each parent. And when you carry it, you have a much higher risk, up to 33 times higher risk of developing Alzheimer's disease at 65 and beyond. So when I discovered that, it shattered my entire universe because coming from a Chinese background, it's all about delayed gratification, all about working hard now, enjoying later. But when you are getting robbed of your later, it didn't really make sense. Everything that I did before lost its meaning, and I decided to solve that because there's not any one problem that I find more urgent and more important than that. Because if any like listeners or you have encountered Alzheimer's, you realize that it's one of the worst thing, probably more worse than dying, because your family members or your close ones, they in the end secretly wish that you would be dying faster. And when you are witnessing that. So I actually work in the hospital in France in the geriatric unit out of continents. And I've seen that whether it's Alzheimer's patients, dementia patients, the ending is really horrible. So I don't want to have that fate, even if it's written in my gene, and I've decided to fight against it, have like full agency over it. And that's why I built the Phoenix community, which is a community for APOE4 carriers. So I'll go very quick on what we do, and we can deep dive into it if you want. But we are basically helping, on one hand, patients, and on the other hand, the pharmaceutical industry to find solutions for Alzheimer's for APOE4 carriers. So for the patients, what we do is we help people find which intervention they should do based on their genetic profile, their environment, their habits, and also their preference. An intervention can be anything as simple as doing more sports, what type of sports, diet, but also supplements, and potentially off-label use of certain drugs with their physicians, right? Generating all this data from the patient side, helping them run experiments. We can then gather all this information and generate what we call digital twins, where we're then able to model each individuals and run experiments digitally on them. The whole goal here is to be able to say, all right, we have 5 people who are similar to you. They have similar genes, similar environments. They have these interventions that are working for them. So you should try these interventions as well. And in the process of trying it, log everything, and that will confirm if it's working for you or not, and then generate additional data. So the more experiments are run in the company, the community, the better. This is the whole patient side. On the whole pharma side, is all this data is incredibly valuable to be able to discover if some people are hyper responders or not to drugs. I'll give you a few examples. When patients are trying a specific drug, and then the pharma is considering a pro-drug to bring to the market, then they can see that anyone who is responsive to that specific drug will be hyper-responsive as well for the pro-drug. So we help pharma discover these hyper-respondents and also to recruit for clinical trial all these patients. And most importantly, we bring the whole flavor between all the data they can have. So you can have blood tests, but you are missing all the flavor between blood test A and blood test B. Let's say your cholesterol was decreased, but what changed? Did you change your diet? Is it a supplement? Is it something? So because we have this whole longitudinal data where we track everything, it adds a lot of flavor on what works, what doesn't, and which patients are good for a clinical trial.
Yeah. I have so many questions. I know we talked about this before, having you on this episode, but I really want to focus on you first before we take a deeper dive into the community and certain other carriers. 11 months ago, right? So what triggered that curiosity? Is it like familial, like Alzheimer's? Do you have siblings? What really inspired that initiation?
Yeah, so I actually don't have family history of Alzheimer's. So you have to know 70% of all Alzheimer's cases are APOE4 carriers. So in our community, 90% of our members have familial history of Alzheimer's. But in my case, my grandparents, they died in the war in Cambodia when they were younger. And I don't have siblings. I don't have all the like family members. My mom passed away from cancer, unfortunately, and my dad actually lived very healthily his entire life, which is great because he's actually doing all these interventions without knowing about it. So, no symptoms now. But what triggered it is I was on a longevity journey. I wanted to take care of my health, so I did this gene screening just to see what I could do to improve my entire supplement stack and have some insight. I never would have guessed I would have those. It's probably one of the worst few genes that you can detect, and I detected that I carry 2 of them. It was a huge shock at that point in time, and it took me a few months to really recover from that.
Mm-hmm. And I'm curious to know that, genetic testing or, these kits, right? It's a consumer product these days, and it's easy if you have the money to buy one, right? And a good one too, right? You can't just trust any product or branding these days without doing enough research. Was that easy for you to choose a company to go with? I know that there's a lot of branding and marketing out there.
Yeah.
How did you choose the one that you use?
So I'll be honest, I thought they are probably quite commoditized. I mean, you have two main types. You have the ones who are looking only at small snapshots of your genome, like snippets, and then you have the whole genome sequencing where they screen everything for the future use. But luckily with new machines by companies like Illumina's and the others, the cost of doing this whole genome sequencing is getting lower and lower. Now you can probably get one for $200 to $250. I'd say between all the companies out there, the differentiation isn't in the screening itself, because in the end, they're using the same lab machines from the same company. The differentiation comes from the algorithm and the insights you get afterwards, because there's a lot of information in your genome, and you could see each gene as a potential positive or negative on any type of risk, right? Let's say Alzheimer's, you probably have thousands of genes that impact it. You have APOE4, which is a huge one, but you probably have all the others that either add a little bit of risk and decrease a little bit of risk. And companies now are differentiating based on their um, ability to detect this entire risk based on all the different genes and calculating the plus and minus to see which ones are the ones where you should focus on. And I like that because it's not just data for the sake of data. It becomes very actionable when, if you know you have a higher cardiovascular risk, well, then you eat like less saturated fat, you exercise way more, and this gives you the additional motivation. And that's something that is extremely important in our community, which is leveraging the fact that we all learn this bad news of having APOE4, but using that as a catalyst for change. And I have to say, I've never been sharper mentally, fitter physically, and happier than now, when APOE4 was the worst thing that happened in my life that was so it can become something positive. A lot of people end up being scared of screening it, because then you feel like you have this Damocles sword holding over your head, but it should not be. You can act on it. You have tons of interventions you can do. And by knowing, then you get the motivation to actually do it. And everyone wants to be fitter and have more energy on a day-to-day basis, right? So all of those, it's not like you're sacrificing something by doing these interventions. They overall will improve your longevity and also your everyday quality of life.
Yeah. Very interesting insights. I was looking at the 2025 annual report put out by the Alzheimer's Association, and they did a massive survey on people who have the genetic risk factor, or some predisposition, right, to getting Alzheimer's, right. A lot of it, I think, was disclosed around being able to like afford, right, like these tests, right, these drugs that are in clinical trials now. Some people don't even want to know, like you had mentioned, or they want to know because they want to prepare their family members or do some future planning. So it's a mixed bag for sure. I think that narrative will change, especially with the role the government's playing, and also pharma, right? That we're putting billions of dollars into this, so
Yeah.
people should take action, right, and be more preventative. And it's crazy because there's 6 stages, clinical stages to dementia, right? And
Yeah.
you're like probably stage 0, right? Yeah, I don't want, like, you don't have to disclose your age, but you look pretty young, and you're ahead of the curve compared to others, right?
Yeah.
And I know you had mentioned that, like, going to get your blood test or speaking with your doctor, these screenings don't happen early enough, right? And doctors kind of shrug it off until you actually have amyloid,
Totally.
and just plaques in your brain, and at that point I think it's too late.
Totally. So the best moment to act is yesterday, right? The second best time is today. So it's not so much as waiting until the symptoms appear to cure it. I believe the healthcare system worldwide, and it depends on the countries, but we're always on the curative side, because it makes sense when you're trying to maximize value of a limited budget. But I also believe that it's each individual's responsibility to take care of our own health. And doing these tests, taking the proper meds, or doing the interventions, which can be free, right? Fixing like your diet and then running, that's relatively cheap to do. This is our responsibility to do. And I really believe in empowering the end patient rather than having patients rely on doctors and the way they're setting up the entire protocols and everything. Like everyone should be very responsible towards their own health, and in the end, it's really an investment towards yourself. I think Warren Buffett, like mentioned, like imagine if you have a car that you can't change for 80 or 90 years, how well would you take care of it? You would shelter it when there's like snow or rain outside. You would polish it. You would change the oil every day. You would probably take care of it like really, really well. But now imagine that it's not a car. It's your body. You only have one body. You have to like take care of it.
Yeah. The car analogy is really powerful in this field.
Yeah. Especially for Americans who like all owns car. It's like,
yeah, but also like our behavior is the same, right? So because
yeah.
unless your car is under warranty, like sometimes people don't even take it in until the engine light comes on, or like it's
Yeah.
actually broken down on the road, right? So that it's similar behavioral. So yeah, it's very interesting
Yeah.
because people kind of use the car analogy and then they kind of stop there and like not tie it into how we still approached it the same. You're like, yeah,
That's true. That's true. Yeah.
it still runs. It still runs. And then like until it doesn't, and then it costs too much, and you're like, now I don't even have a car. But it's very interesting. And I think
I mean, to your point there, right? You have this matrix where you have on two layers. I like those 2x2 matrix. That's probably the consultant in me. You have importance and urgency. And so you have the important and urgent, important, non-urgent, non-important, urgent, and non-important, non-urgent. So it's very obvious that the non-important, non-urgent you kill. But what is not that obvious is you should not focus so much on the important urgent to the point where you don't do the important and non-urgent, because the important and non-urgent things can become much bigger problems as soon as they swap into the urgent thing. And a very easy example is, let's say you have a small toothache and you feel like, oh, it's okay, it's not that urgent. And you wait until the decay is there, and then it becomes huge pain and the cost is higher, the pain is higher. So it's really important to take care of these like important non-urgent thing, which includes health,
yeah,
especially when we're young.
yeah, usually the low-hanging fruit, low-cost things, right, are kind of like we're like, oh, I have more urgent, more important things to do. So they get kind of like down on the list of things to do. But no, this is great.
Definitely.
I'm really grateful that you've created such a community to I don't think we've helped patients or people empower themselves in this field enough. So super glad that stumbled across the Phoenix community. Tell me, how big is the community now, and where are most users or patients?
Yeah, so we have 1,500 identified APOE4 carriers in our newsletter, and we have 250 now members that are in our community that are tracking all these experiments and everything. So we're growing by 60% month on month, so growing very, very fast, 4 new members every day. And I want to say surprisingly, but in the end, not that surprisingly, 85% are in North America, 80% of the total are Americans, you have 5% Canadians, and then the remaining 15% across the world. And that's why I decided to come here to San Francisco from Singapore, is because I feel like everyone is here, so I'd rather like build here than from the other side of the world.
And it's important to connect with them in person,
For sure.
and also be more accessible, right?
Exactly.
So people don't think you're an AI generated, digital twin here.
Not yet.
Yeah. So this is great. It's no surprise that most of them, well, this is also self-reported too, right? Or do they have to demonstrate some type of proof that they're either a carrier or know someone that's a carrier? Like, what's the application and registration process like?
Yeah, so I mean, we make it very clear that the value that we bring is for APOE4 carriers, and if they're not, there's no point. So it's a paid membership there, because we don't believe in getting affiliation with whether it's all these companies that do interventions, who will never get biased by being tied financially. So we'd rather take a membership fee from the members. So there's not much value if they're not APOE4 carriers, but also the majority of our members, they upload their gene tests. So it's there.
And is there an app?
Yeah, so the app is coming in January. We have a web app. We have everything ready for desktop use. And then we realize that everyone is using their mobile, even at that age, because our members are 80% of them are between 50 and 70 years old. And I personally thought they would be more on desktop, but everyone is using a phone today. So we are developing our app now and it's coming in January.
Oh, wow, that's exciting. And definitely want to highlight that once it comes out. And what is, I'm just thinking because, a lot of us who have like the Aura ring or the Whoop, right? There's a lot of like self-journaling, right? That you have to do.
Yeah.
So you have to stay accountable, right? Stay interested, stay passionate about your health. What is the time commitment for a typical user? Like, what is like, how many entries are there on the what, like the web platform now that people like, what, like, do they have to do it every day? I'm pretty sure every day or every week.
Yeah, so you have a few things that you need to do when you onboard, and then a few edits that you would do along the way. So when you onboard, it's mainly getting a snapshot of where you are today, and that starts the entire journey. So it's really understanding your family history, your comorbidities, having all the history in terms of blood tests and any medical exams that you have, understanding what you're doing today. So that includes adding all the supplements that you have and everything. So I admit it takes a bit of time, but they get a lot of value straight away. For example, once they upload all of that, enter their supplements, then our AI is already able to say, oh, based on your profile and all the supplements that you seem to be taking, and they also mark the efficacy and the side effects on each supplement. You might want to try this other supplement because a lot of our members who are doing exactly the same thing as you, they have good success with that one. So they get a lot of value along the way. It will take around probably 1 hour to onboard, 1 hour and a half at the beginning. After that, we do monthly check-ins that are quite extensive, where we again look at all the commodities changes and the tests that they've done and so on. And then we have daily check-ins, which is very, very fast. It's just checking in a qualitative way on how they feel, how is the mood, how's the stress levels, how did they sleep, and so on. The key point here is to open that as a journal where they can enter in free form whatever happened the previous day. Because what we gather is once we have the app is all the information that you have from Apple Health or the equivalent, which is probably Android Health, Aura and everything. But same thing, you want to have the flavor between like these different hard data points, right? If the sleeping score was bad like yesterday, what happened? Did they change the supplements? Did they do something else? And we are building this entire platform where we add on this type of flavor.
Wow, that's a lot of work, but I think, I mean, that's the only way you're going to get value, right? If you tabulate everything. I think that's itself is a memory test. Sometimes I don't even remember what I ate on Monday. It's like, what, so it does
I agree.
take
Yeah.
a lot of rejogging there. But yeah, I think that's incredibly important, especially if you're able to pair public databases, right? Even noting where they live, right? And if there was a higher chance of someone or their symptoms getting exacerbated, right? Because of some environmental condition or toxin in the air where they live.
Beyond all that, it's also where we have this entire community where we have a lot of different spaces where people can share about everything that they feel like sharing. And the plan here is to use that to capture information as well. For example, we had a patient that was mentioning about sensory tests and specifically olfactive training. So it's because when you get dementia, Alzheimer's, all your senses actually are blended and then you lose your sense of smell. And we're discussing about that. And like myself, I feel like I knew that at around 25, I stopped really smelling the sea when I go to the seaside. Like my sense of smell would be like very, very blunted. Then, I replied that in the forum, but no amount of questionnaires or check-ins would have been able to capture that information. But because we have a forum that is connected to our app, all these different type of insights that are written there, it helps build the digital twin, this entire picture of a person captured in a way that I'm hoping is user friendly, rather than tons of questionnaires everywhere with tons of questions. Here it's more like, okay, you think about that, you will share that part about your life, and then it's captured. It's never lost.
Mm-hmm. Yeah, incredibly important. And you're building a infrastructure there too for clinical trials. I think, I think
Mhm.
in the future, the app can alert someone like, hey, there's a clinical trial happening in your neighborhood, like, and you're
Yeah.
eligible or something, so like that's important
For
to
sure, because that's one of the bottleneck that we have, right? Uh, Even in the past, when I was consulting for pharma companies, I actually worked on a few Alzheimer's drugs, but coincidentally didn't even know I had my APOE4 status then. And one of the biggest pain point is patient recruitment and not having patient drop out of the clinical trial. And we had so much pain to recruit patients because each day that the clinical trial is delayed, especially for those potential blockbusters, you're potentially losing like 500K per day. So you really don't want to delay anything there, and you want to be able to find those patients. But the problem is those patients, even if they are motivated, they might not even hear about it, and they need to go through the physicians. So the physicians need to know about the clinical trial happening, and they need to remember that they have this patient that might qualify, and they need to link the two of them. And then you have another layer of issues is a lot of the drugs, for example, nowadays, they would look at exactly when to target the patient, which is usually when they start having cognitive decline. And the problem in that is they'll give them a battery of tests once the patient enrolls to see their cognitive levels. So if you use an arbitrary number, let's say a patient is at 70%, then they don't know if they've been at 70% for the past 1 year, 2 months, several weeks. They don't know if cognitively, maybe their entire lives, they were at 70%. So then that creates an additional noise. And imagine that you have, let's say, 10 people that should not have been enrolled because they didn't decline actually, and they were like that for like years. Well, out of a clinical trial of 200 or 300 people, that's enough noise to actually make the entire clinical trial not succeed and the endpoint like not succeed there. So I feel like it's extremely important to recruit the proper patient.
yeah, I feel like we've been hearing about a lot of Alzheimer drugs candidates, right, that fail the phase 2,
Yeah.
3
Yeah.
um stages. Do you think,
And not by much, not by much.
yeah,
So it could be like 10 patients that go to the other camp there on the successful or failure on the biomarkers, and that would have changed the entire thing. So it's a bit crazy that it only plays out on that.
yeah. And so it's multifaceted, right? Because a lot of people blame the drug or blame the company,
Mm.
but it's really, I think the recruitment has to do with a lot of it, like you had mentioned, right? And also, like, are people talking about it the right way? Because there's a lot of discussion about, oh, it was just like not, it wasn't a targeted, precision medicine type of drug, right? That's why it failed. But I don't,
Yeah.
yeah, there are multiple arguments and multiple layers that we can spend maybe like a day talking about. But it's sad because everyone, there's so much money that's going into it, and you're like, oh yeah, I failed, and we spent billions fail, with these results, and so
And it's a
everyone,
big problem to solve. It's a very
yeah,
big problem to solve because it makes sense to invest money there. Like each patient with Alzheimer's costs society overall like 400K. So that's a lot of money per patient that are, like still taxpayers, could still be functional, that will not be taking time out of the caregivers. Even if we remove the entire emotional side, if we look at only the economical side, having someone get dementia or Alzheimer's is so costly for society. And to your point on precision medicine, I agree. I believe that we are starting to reach a stage where, with AlphaFold and all these AI that are able to churn out tens of thousands of molecules at the preclinical stage, the next bottleneck is clinical trial recruitment because you can compress as much as you want preclinical research. When you're going on human research, well, you can't really compress that because you need to see it on actual humans. Right? No AI would be able to help. So that's where we come in, like right at the recruitment phase, because that's the next bottleneck.
mm-hmm. And I'm
And I
super,
really believe in like right now we're looking at one drug for many. I really believe that the future is many drugs for a smaller subset of population that are hyper responders for that specific drug.
mm-hmm. Mm-hmm. No, that's amazing. And going back to the 6 stages, the clinical stages, right, of Alzheimer's and dementia, right? Like I can also see it in terms of the recruitment strategy. like, because you know the age of these patients that are enrolled in the community, right? What we know, would
Mm.
phase one be like like stage zero, like of people, right? Like people like yourself that are young and have the genetic risk factor but don't have symptoms yet. Like, would that be like
Yeah.
like a control phase one or a subject group phase one, and then like expanding that to like older age groups, right, that have some sort of mild and like cognitive impairment or some tau or some low APOE levels in the blood or something, right? Like, yeah, I think that like framing it and also just clinical study, just yeah, planning for the clinical study correctly is a lot of work too. And I think you need to get a lot of clinicians on board and doctors there. And I think that's also a bottleneck.
Yeah.
A lot of people have a lot of opinions, and then they're not wrong about it, but there's a lot of noise too that we have to chart through.
Yeah, and it's the way those clinical trials are designed that matter. The design of each clinical trial and how robust they are that can make or break the entire thing.
Mhm. Just
Definitely.
making it more accessible, and if that's why you going on YouTube and educating everyone is one step, right? And making people aware of what they can do and how actionable and accessible it is.
Yeah, and if I have one message here, right, it's I want to remove the stigma of carrying APOE4. In our community, we actually have quite a lot of let's say celebrities or people who are well known, whether they're I don't want to agree with too much, but potentially politicians, people who are very active and so on, and they're actually scared to show that they have the APOE4 gene, even though before 65, there is almost zero chance that they would have any type of cognitive impairment because even though you start accumulating amyloid at actually around my age, I'm 35, you were asking at the beginning, you actually have a brain that is able to compensate a lot and not have any decline until you're 65. So it would not matter on the way they perform. But still, there is that stigma that exists. And when people reveal that they carry APOE4, they have the feeling that and when they explain what APOE4 is, they have the feeling that people look at them a little bit differently. So I'm taking the complete opposite approach. I'm being extremely public about it. And I'm saying upfront, I am way sharper than the days I was at PCG and working crazy hours at in my 20s or something, right? So it can definitely not be the case that you have any cognitive decline, and even the opposite, because you know that you carry the gene, you are more motivated to do interventions, and they have direct impact on your cognition and your ability to work and perform today. And that's really a message that is important to not see that as fear, but as empowerment.
Yeah, and not a checkbox on some sort of
Yeah,
job application, right? We're trying to fight
yeah,
ageism too, and I think that's
yeah.
a similar standard there. And putting yourself on, like, yeah, it's really
Mm.
frustrating to hear about those stories and people being categorized differently. Um, but you're taking action and you're proving everyone wrong. So props to you there. So moving on to some of the drugs and testing that are now in discussion. What are you most excited about, like pathology wise? I think your latest video talked about some updates from like the ADPD meeting, right?
Mhm.
Liver and heart playing a big role, right? We've heard a lot about the gut brain axis, and I think the
Yeah.
gut ties really correlates really well with liver function as well. What are you most excited about in the next 2 to 3 years in terms of testing
Oh, 2 to 3 years
personalized
is
medicine?
short. 2 to 3 years is a little bit too short. I take 10 years. In the 10 years horizon, I'm very bullish, so very optimistic about CRISPR. I actually did my doctorate thesis on CRISPR, so I've been looking at that for a long time. Gene editing. I've been looking at editing APOE4, so the gene, to APOE3, which is what the normal population carries, or to potentially APOE2, which is a protective allele, and it's actually only like a very small number of bases to change. So it could be an extremely good target. The only problem is, as always, the access to the brain and making it available there, which means that you have other type of technologies that are coming in, which are nanobiotech, which can be this vehicle for the therapy, but also we are seeing progress in repairing the blood-brain barrier and so on. So nanotech, CRISPR, I believe like those are very, very promising type of tech that are coming hopefully in the next 10 years.
Yeah, we've learned a
Yeah.
lot with other neurological diseases too, right? And
Yeah.
disorders, and have paved the way for CRISPR and gene editing. I think also going against the dogma of like, oh, genes can be edited, right, or changed.
Mm.
Like that's one of the risk factors that, your age is something you probably can't change, like your chronological age, right? That's one factor. Like genes that are yeah, like the alleles, right? So it would be
Yeah.
interesting. At some point, do people all just get the APOE2, right? Because everyone wants to protect themselves. Right?
Yeah, I mean, for sure, for sure. There are probably a lot of side effects there because the problem with gene editing is you can't really do a control Z, so return if you screw up
Yeah.
the editing, and it might not be specific enough, and it might like create some damage like somewhere else in your DNA, right? So they will always come with risk. So I don't think the general population will want to do that, but when you're at a higher risk, it will make sense to do that for sure.
Mhm. Yeah, once everyone wants to go wants every shiny things, right? And they want to get their hands on
Yeah.
that.
I mean,
No,
it's a risk-benefit balance, right?
yeah, there's a lot of
I do believe those come with risks still.
yeah, there's a lot of risk. And of course there's the ethic board, right? And I'm pretty sure there's going to be some guidelines and discussion around that. So, and yeah, I mean, 2 to 3 years, yes, it is pretty short. But there are a handful of drugs now, right? So maybe even 5 to 7 years, we'll see something promising and into patients who are predisposed. So
Yeah, I'd say the ones that are like relatively successful now are all the monoclonal antibodies. Unfortunately for APOE4 carriers, we have a higher risk of brain bleed called ARIAs. So even though we're at a higher risk and the benefit would be like great for us, we also are higher risk of getting the side effect, which can potentially be deadly. So again, it's a very personal choice. And I also believe that there are ways to potentially screen for our like a risk of getting ARIAs, and that would make way more sense. If we can decrease the risk for side effects, then it's also almost as good as increasing the efficacy because then more people would be willing to do it, even if the efficacy is smaller.
mhm, mhm.
But yeah, like today, it's a very tough choice. I see a lot of patients who are asking these questions, and those questions are impossible to answer for them. It's a very personal thing. Yeah, it's deciding between getting Alzheimer's, losing their identity, or getting potential side effect that might like, kill them.
Mhm. And I'm curious, it would be interesting to know if any of the anyone in the community, the Phoenix community, are also diabetic, have some sort of cardiovascular risk, or even on GLP-1s, right? Because I know there's a lot of
Mhm.
preliminary evidence showing protective effects on the heart, the lung.
Yeah.
So, I don't know if that's a questionnaire and in the
It is actually. We're screening for all comorbidities and what they're doing. So yeah, definitely we have some diabetic patients there, whether it's type 1 or type 2. A lot of patients with comorbidities, but the big value for GLP-1 is microdosing it, even for people who are not uh, obese or diabetic, or people who are extremely fit with a very healthy IMC. It seems that through a different pathway other than just the cardiovascular benefit, it has some benefits on decreasing Alzheimer's risk. So we have some patients who have been microdosing it right now. And I believe that's as well initial data points for a potential pharmaceutical, like a trial on GLP-1 for Alzheimer's when we have those results from our patients. And even if every time it's an N equal 1, so non-replicable, not in a clinical setting, but we've seen like extremely good results. We've seen even sometimes our members are caregivers. So they carry APOE4, but they're also doing the same interventions for their parents who have Alzheimer's, and they have reported tremendous benefits. Sometimes parents who are able to be in full clarity for at least 15 to 20 minutes and hold a normal conversation when it was not possible before, which is incredible to have that.
I think we found our drug. I'm kidding.
I mean, I wasn't saying about GLP-1 specifically here, but
Uh,
yeah, a lot of different interventions, like somehow like lithium, red light therapy, all of these
mm,
different, uh, whether it's like medtech or it's other compounds, they seem to all of them together at least have some kind of effects, positive effects. So something is working.
yeah, yeah, collectively. Uh,
Mm,
yeah, and these are evidence-based. I think a lot of hospitals, clinics, even research institutions are focusing on a lot of just research-based, evidence-based protocols, right? Not just
yeah,
outside of drugs, right? Because
yeah,
when you're thinking of your general population, right? You're a 50 to 70-year-old, right? A lot of them are already on drugs and they don't want to add any more to it, right? So I'm sure, as you know, as a pharmacist here, you know a lot about polypharmacy, right? And the interactions in that. Um, so it's gonna, I think medicine will take it. It has been taking an interesting turn already, right? So
yeah.
is it like, can we de-prescribe, right, and then introduce other like healthier evidence-based protocols, right? Like, you know, exercising or, you know, red light therapy and such,
Mm,
a healthy diet, right? So these are more accessible. I think the education, I think being informative in the
sure.
field is still lacking, and that's what you're doing, right? So I want to turn it back to you as a 4/4 carrier. What, I am sure you have a laundry list of things you're doing, right? I'm sure you sleep maybe, you know, optimal hours. You try to help eat a pretty moderate, healthy diet, maybe focus on the fats. I think we spoke a lot about, or not a lot, but briefly on, you know, the ketogenic diet, which was
Mm.
pretty hard for you to stick to. You know
Indeed,
what?
yeah.
Tell us what you do, and you know, for folks who aren't in the Phoenix community now, this will give them probably a
Mm.
bigger reason to join.
Yeah, and I want to say, like, based on your comment before, right, the main issue with having tons of medication and everything at the same time is you don't know which one is working, if they're working together, if some of them are doing nothing. And what we encourage our patients to do is to isolate each intervention, take it for 3 months, test before and after. That's the entire experiment time, and don't change anything else because otherwise it creates so much noise everywhere they can't do it. And that's really something that is important. And of course, when you are, let's say, 65, 70, feel that your mind is slightly slipping away, that you want to try everything at one go, totally understandable. But at least for the younger people, and that's what I'm trying to do as well, not be patient and isolate. Right? So in terms
Yeah,
of things, yeah, go ahead.
I think that also introduces confusion, and at that stage,
Mm,
right? You don't want confusion, right? Like that's
sure.
almost
Yeah.
to the point where you're like, you know, having delirium or something. You're just in a
Yeah,
confused state all the time, and you know, you want to, yeah, and you're doing more harm than good at that point.
for sure. So to your second question about what there is to do for brain health, cognitive health, and this is not specific to APOE4. I'll point out the part that is specific to APOE4 carriers, but overall, and I'm almost sorry to say, there is no magic pill that is easy to take that will solve everything. Like my first comment is supplements is probably 5 to 10% of the overall impact. Like if you're only doing that, it will do nothing. Um, it's not a magic pill. It won't be solved. The main thing that you can find is what you mentioned, which is everything that is good for your heart and your cardiovascular health will be good for your brain because the more vascularization you have, the more you'll be able to clean up the amyloid and all the deposit in your brain. So that's the usual thing that people don't want to follow because it's hard to do, but you still have to do them. It's exercising as much as you can, and not only doing one type of exercise. We're talking about high intensive interval trainings. We're talking about cardio, like zone 2 training, but also strength training. So those three must go in. I personally do between 12 and 14 hours sports per week, and it's an investment in time, but that yields a lot of results. Then sleep is definitely there as well. Of course, the two are connected. The more sports you do, technically, the better your sleep. But when you sleep, that's when your brain clean up all the junk that accumulated during the day. So you definitely need not only good quality sleeps, meaning the 3 stages of sleep, but also enough time sleeping. And that's where I'm struggling because I'm relatively stressed, and it creates moments where I can't really sleep properly. So those two are there. The third one is obviously like stress as well. This is one of the biggest risk factor for Alzheimer's, for dementia and cognitive decline. So lots of interventions that you can do there, whether it's like journaling, gratitude, meditation, to each their own. I think that's really an exploration. It could be like walks in nature as well. A lot of things that you can do to reduce stress. Good thing is stress is very easily measurable in a quantitative way, for example, with HRV and so on with Neuralink. So then you have these three main buckets. And then you have the whole diet part, which is more APOE4 specific. So APOE4, maybe we should have started with that, but it basically codes for the gene. APOE4 codes for protein. That is also called APOE4, so a bit confusing. And this protein has issues transporting cholesterol and saturated fat, which means that when it happens in your heart, well, it creates an additional risk of heart disease and cardiovascular diseases, which APOE4 carriers have as well. And then when it's in your brain, then you get Alzheimer's and dementia and cognitive decline. So how do you solve it? Well, you cut all saturated fat out of your diet. So less red meat, less pork, focusing on good quality fats like olive oil and so on, and Mediterranean diet. And if you can, then keto. But the problem with keto is it's not the easy keto where you can eat tons of ribeyes and do it. It's a low saturated fat keto, which is horrible to do because you are kicking out all the glucid, like the sugar, and also kicking out all the good stuff like the saturated fat and so on. So you don't have much left that is like tasty. But definitely keto diet have proven to work really well. Fasting has a lot of benefits as well, whether it's like multi-day fasting. So I used to like fast for 3 days straight, water fasting, so only drinking water, or also intermittent fasting. So trying to keep the eating window like in a window of 6 hours if possible. So let's say 10 a.m. and then until like 4 p.m. or something like similar, right? What else? You have all the toxins that you have to remove. So toxins like alcohol, which is a big no-no, even one drink. And I know we have like tons of studies who have actually shown that one drink per week, I believe, is actually protective. And actually people who drink a little bit of wine or alcohol have like less Alzheimer's and so on. But I really believe that this one is a huge confounding factor. It's just because they are drinking one drink. It might be because they are more social, because it's in a social setting. So the social aspect might be compensating for it. Like other type of research isolating alcohol have shown that even one drink, there's no like minimum there. So going to zero, so no smoking, not getting heavy metal intoxication, no mold toxicity, and so on. So those are kind of the hygiene factors that we want to fix. And I think we have everything there.
Yeah, I agree with you on the alcohol point.
Yeah.
I clearly my Whoop knows that alcohol disrupts my sleep. Like
Oh yeah, for sure. Your REM sleep will be destroyed the next day. Yeah.
exactly.
It's like, yeah.
It's a horrible thing, but I still do it sometimes.
Yeah, I mean, we all have to live, right?
Yeah.
It makes no sense to try to maximize your health span or lifespan if you're not enjoying every day. So I always find it a bit sad if people are spending like so many hours every day to do things that they don't like to do just to extend by one more day, right? But then your days are not that fun either. And I'll admit, I also like drink from time to time. I know it's bad, but you still have to enjoy life. And it's all about doing things that are sustainable.
Yeah. And I'm just thinking just earlier when you were listing all these things, right? Especially like exercise, resistance, high intensity, right?
Mhm.
I'm just thinking if I was listening to you and I was, 65 or 70 and I'm frail and I, had a hip fracture in the past and, I don't have the strength to do it. Like there's probably alternatives, right? Like maybe just walking for 45
Yeah,
minutes. It really depends on the time, but also if you're able to, right? I think resistant bands are really easy too. Having, going to PT, maybe
yeah,
if you already have someone to do that. Uh, so I think, yeah, it's very personalized depending on the age group and how much bone mass and muscle mass you have.
absolutely. Yeah.
So that's also something that I've been very interested in, and just also just the protective effects of being a female, but also incurring all these late life, right, prognosis and pathology, especially for people in like women in menopause who get
Yeah.
menopause. So a lot of gaps that we're all trying to figure out here with research. But
And personalized medicine, right? When you have clinical trials that are done on a majority of white Caucasian male, when you're a female, non-Caucasian, I don't know how much of it you can trust on your own body. Right? It will be like extremely different. So having these clinical trials that are very adapted to your own genotype and so on, I believe are very important as well.
yeah, but that also increases costs,
For
right?
sure, yeah. Unless it doesn't cost that much to recruit the patients,
Yeah,
which I
exactly.
believe
Going
we
back
can.
to the recruitment and the study design.
Yeah, yeah.
Ugh, there's a lot. I know we're always
Mm,
putting pressure on scientists and be like, you're not doing, you're not doing enough, but there are bottlenecks in each phases, right? So
yeah,
I'm also very bullish. I'm excited to see where the field takes off in terms of Alzheimer's and dementia and just brain disorders, right? A lot we've learned
yeah.
a lot from Parkinson's as well, ALS. Um, I'm sure there's a lot of overlapping mechanisms there that we can learn from and apply to people who have Alzheimer's, right? So this is super exciting. I know
It is.
we can talk for days, but we're gonna be respectful of people's attention span these days too, not just memory. So I very appreciative that we cross paths and I get to highlight you
Likewise.
podcast. And if people are really interested in learning more, they can go to the Phoenix community, right? Because I know there's another
Yeah.
the Phoenix website, and that's focused on drug addiction and all those things. So don't go to the
Yeah.
wrong site. It's the
We'll
Phoenix.
leave the link in the description, but
Yeah,
it's the Phoenix, so Phoenix dot community.
yeah, yeah. Dot
Yeah.
community.
Yeah.
That's
Oh,
key there. But yes, we'll link your LinkedIn profile. I know you're pretty active there. Your
mm,
YouTube channel, the website, so people can learn and sign up. And yeah, and or word of mouth, right? Telling people about it. So very, very grateful. So thank you for your time, Kevin.
thank you so much, Brenda, for having me.
Yeah, of course. And for those who are listening, I hope you enjoyed this episode. It was a different one, but very important. So, yes, thank you all for tuning in and stay tuned for the next one. Bye, guys.
Bye bye.